start with the special interest I have about destigmatizing mental illness. And you might be wondering what I'm talking about. Basically, it's about it's thought of very much importantly by the Royal College of Psychiatrists and all the Royal College of Physicians and most doctors now that it's extremely important for us to have a campaign, and we have got lots of campaigns going on for the last many years, that mental health is the same as physical health. There's no difference. The pain of emotional pain is the same as a physical pain, and so therefore it's very important for us to recognize that. And also because people don't come forward when they have emotional pain because they feel they're going to be judged for it or going to be stigmatized and put into a category of, they're going to do something dangerous or something, the olden days of being a lunatic, etc. It's nothing like that whatsoever. And so I just wanted to start with that, and also to just say that mental health is such an important aspect of a physical health, that with good mental health, you can maintain better physical health. And when mental health is not attended to, the problems with diabetes, for example, can get worse, and problems with diabetes can make mental health worse. So, and there's some statistics that people with diabetes are 2 to 3 times more likely to have depression than people without diabetes. And I think that applies to all chronic illnesses, not just diabetes. And also there's also some statistics to say 25 to 50% of people with diabetes who have depression, only those get treated. The rest are a hidden population that don't get treated. Treatment is very effective, and I'm not just talking about medication. I'm talking about therapeutic types of treatment, talking therapies, and of course each treatment needs to be tailored for each person. So I'm coming back to saying here just briefly about stigma, that 40% of people with anxiety and depression they are prevented from seeking medical help because of stigma. Now, that's a very serious amount of people, a significant amount of people. And it's about feeling, sometimes people blame themselves as well for having any depression and anxiety, and then it lowers their self-esteem. It's really important that, we look at that in a very kind and compassionate and non-judgmental way. And stigma also profoundly affects people who what people feel about themselves and how others see them. So this is again just going through, and what happens is there's a lot of shame if somebody is diagnosed with a depression or anxiety, which actually is such a normal part of our everyday lives now. There are lots of doctors and nurses who get diagnosed with depression and anxiety, and at the moment, there's a recognized in the NHS as you needing time off for these things. They're just as important as physical health problems. And it affects people while they're experiencing the problems in treatment, and also how people feel about themselves and how others see them. Things you can do to reduce stigma. One very important thing is to educate yourself about mental illness. Be aware of your own attitudes towards mental illness, behavior, judgmental thinking, and also choosing your words carefully, passing on facts and positive attitudes. And stereotypes are really important to challenge. And focus on the positive. Mental illness is only part of anyone's whole picture, larger picture. Support people, treat everyone with dignity and respect, offer support and encouragement, include everyone. It's unlawful to deny jobs or services to anyone with these health issues. They are health issues. And okay, I just wanted to go to another thing about, before you change slides, that anxiety and panic attacks are also very much part of mental health issues. And also stress, just general daily stress that everyone goes through. Then the stress hormones can make blood sugar levels rise or fall, and unpredictability. And chronic stress is another problem with many people. We all burn out over long periods, and these can lead to other issues such as heart problems and strokes. So it's very important to pay attention to the level of stress you're undergoing. And studies have shown very strongly now that counseling and psychotherapy work well for anxiety, depression, and panic attacks, sometimes with antidepressants, sometimes without. So that's part of what to do. There's something called diabetes distress. Now, diabetes distress is very, 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 very common, but sometimes people feel they can't express themselves, they can't express their distress because they have to get on with things and getting on with things. And the trouble is, you have to get on with things, what's actually happening inside you and your body. You may feel discouraged, worried, frustrated, tired. You feel that diabetes is in charge and you're not in charge. You try very hard and you're not seeing the results. And you have a diabetes related health problem in spite of your best efforts. And it's really important. It's just a normal. What I'm trying to say is so much of this is just normal. There's no pathology associated with it. It's just a completely normal thing that happens with diabetes. And, and it's a very recognized symptom. Okay, so I'm just thinking of some tips that for coping with diabetes distress. Pay attention to your feelings. It's really important not to ignore your feelings. We can live in a culture where we put our emotions and feelings to one side because they're not important. And paying attention to your feelings is extremely important because what happens is you need to observe yourself. So you become a neutral observer of your own self, where you recognize, I'm feeling really fed up, I'm really feeling irritable, I'm feeling burnt out. And it's important to talk about those feelings and also to talk about other people's reactions that people have about your diabetes or about your stress levels, to talk to somebody like a healthcare provider or a therapist or a counselor, because you don't have to take on other people's negative reactions to how you are. And because you're just a unique human being and your humanity is universal. So talk to your family and friends who you can trust, and allow loved ones to help. Talk to others perhaps who have diabetes as well. Pacing yourself, very, very important, that you don't have to do everything all in one day, and do one thing at a time, and make time for the things you enjoy, most important, because that's when you enjoy something, the right hormones are secreted. The same hormones are secreted when you take antidepressants. When you enjoy something, the same happy hormones are secreted in your body, in your brain, and with serotonin, dopamine, all those things that you may have heard of. So one of the biggest challenges for those trying to manage diabetic care is the low rates of people coming for help. So it's important for doctors as well to recognize the frequency of how people are hesitant to come, or trouble people, and they're worried about other people's judgment, especially about mental health issues. And depression in diabetes can be associated with increased complications as well, physical health complications. So that's the other reason why. So I just wanted to highlight these things and how normalizing it is to just feel not judged. It can be difficult at times to be aware of your own emotional state, as we live in this society that we tend to bottle up our emotions and forget that sharing with non-judgmental other people who are willing to listen can be a very enriching experience and a deeply connecting and healing experience. So, it's very, very crucial that these things are not ignored. And, you can feel upset. That's all you're feeling, upset, lonely. There's such normal feelings. There's nothing wrong with any of these feelings, but pushing it away makes it come out in a different way. Sometimes it can affect how you push things away. The last thing I wanted to say was about touching on coronavirus and the effect that coronavirus may be having on diabetes. And there's cases of new type 2 diabetes diagnosis that have been reported in people who've had coronavirus. And I'm sure some of you would have heard about it. And this is speculated that this could be due to an increase in inflammation inside the body caused by coronavirus. This inflammation can bring about insulin resistance. So there's still a lot to learn about coronavirus and how it interacts with our immune system, and also the long-term effects, including long COVID. Now, long COVID also has signs, symptoms of depression and anxiety, and that's been recognized quite strongly, and people have being given counseling for that. And also scientists are also looking into the possibility that coronavirus could be causing diabetes by directly damaging the pancreas. This is nothing to do to frighten anyone, but it's just to say that, just to be aware of these things that can happen and to look after yourselves. So managing your physical health, eating the balanced diet, as you all I'm sure know very well, vitamin D and all those things. And also becoming aware that changes in your blood sugar can cause rapid changes in mood. And you can also get very exhausted and tired, and mood swings, and can lead to burnout. So in conclusion, I just wanted to emphasize the universality of experience of pain. Become aware of your own emotional state, and emotions are very important part of who we are as people. Pain and loneliness, anxiety, and low mood are universally felt. Become your own observer and don't minimize your own feelings. Being upset and lonely are normal feelings. And that's the other thing is, don't let a bad day prolong into a bad week, into a bad month, into a bad year, and seep into all areas of your life, including work and relationships. So reaching out to an empathic and kind somebody, or support groups which are kind, have the similar kind of empathy, is very important. Thank you.